Welcome to Module 3 of the Access Pain Management Education series. So far we have covered topics such as why we get pain, how acute and chronic pain are different, how the nervous system works normally, and also the problems that occur in the nervous system in chronic pain. In this module, we will have a closer look at the brain's role in pain and how our thoughts, emotions, beliefs and past experiences can affect your pain. Recent research in pain management has found that the type of responses you make to pain can influence and even predict how well you recover from chronic pain. Some of the responses to pain in the chronic stage may not be helpful and in fact could slow your overall recovery. Some of these responses are automatic, such as muscle spasm, and other responses are conscious, meaning that we make a decision about what to do. We would like now to discuss the types of responses which may occur in response to pain and how they may affect your recovery. I'd now like to introduce to you Nathan Seafeld, who is a psychologist. Hi Nathan. Nathan, current research has shown that the way people respond to pain can affect their recovery. Can you give us some insight into the types of responses that can occur and if we have any control over them?
Because our experience of pain is unique, it follows that our response to pain is also unique. A very common response is fear of further pain, which is accompanied by protective behaviour. This may include holding our bodies in a certain position or avoiding an activity. With chronic pain, this becomes a problem if we continue to avoid pain at all costs, move our bodies less, and become deconditioned. Sometimes looking at pain differently is important. Trying to understand the message behind it and working through the pain is a more adaptive approach. Pain is a part of life and can be best managed with some level of acceptance and working towards improving function.
Here's a question. The severity of the initial injury is the only factor that determines the severity of pain. The answer is false. There are many factors that contribute to a pain experience.
We know that the brain has a powerful role in interpreting the various inputs that make up pain. Let's now look at what other factors can influence pain perception. Our response to pain is unique, and this can be explained by the many factors which influence pain perception. Some individual factors to consider include our age, gender, belief systems, past experiences, and our personality. Situational factors include our work and home environments. It also includes the important people around us in those environments and how they might respond when we're in pain. Emotional factors can have a powerful effect on our pain. Common emotional responses to pain are fear, anger, frustration, and if these are left unchecked, they can significantly increase our levels of suffering. Let's consider how these factors might influence how we experience pain. Let's consider a person who has an existing back injury. They are late for work, have a fight with their partner on the way out the door, and forget their lunch and ID badge. On the same day, the boss increases their workload when they're already feeling a little overstretched. What levels of pain are they likely to experience on that day? You might have answered that their experience of pain might increase under these circumstances. Why might this be so? One explanation is that all these factors are significant stressors in that they place demands on us and our coping resources. Pain is also a significant stressor, and when we have many stresses at the same time, we can feel overwhelmed. In the midst of increased distress, the pain experience is heightened.
Nathan, Matthew explained to us in Module 2 how the nervous system becomes highly sensitised in chronic pain conditions and how the brain also analyses and interprets the danger signals. Can you tell us how our thought processes can actually affect our pain experiences?
Our thoughts can be considered as simply another nerve impulse. The major advantage is that we can have more direct control over these types of nerve impulses, in that we can direct our thoughts. Let's have a look at a specific type of thought called an appraisal. An appraisal is the way that we sum up or give pain meaning. It happens very quickly, and often so quickly it is beyond our level of awareness. In chronic pain, we often respond automatically. These automatic appraisals can be broken down into three categories: threat, loss, or challenge. Let me provide you with some examples of how each response can impact our behaviour. If we appraise pain as a threat, we're likely to experience fear and focus on trying to stop any further pain. We often avoid further activity and movement. If we see it as a loss, we experience sadness and may even get depressed. Again, we are less likely to move and adapt to our new situation. However, if we see the situation as a challenge, this will give rise to feelings of commitment and is more likely to lead to behaviour such as regular exercise, movement, and seeking out treatment and advice. How we interpret the situation is very important to how effectively we respond. People with chronic pain can often have feelings of depression, stress, anxiety, and difficulty concentrating. Chronic pain takes away our sense of self-control, and this combined with other stresses can result in increases in anxiety and depression. It's normal to feel some anxiety and sadness after injury, but if left unchecked, it can have lasting effects on our life.
Memory of past pain also has a strong effect on our motor system or our movement. For example, if last time you worked at the computer for an hour and this caused an increase in pain, you will probably start to anticipate that this will happen again. Maybe after 40 minutes, you will begin to expect the pain to come back. This expectation can make you more tense, causing muscles to stiffen or spasm up. Your stress levels may start to rise, releasing stress hormones which can trigger off sensitive receptors around your old injury. And you may lose concentration on what you are doing because you are waiting for the pain to come on. The memory of pain affects how you move and react to situations in the future, even though they may not actually be a physical threat to initial injury.
Here's another question for you. Anxiety and stress levels can have a significant effect on pain sensation. True or false? The answer is true. These type of emotional responses can have a significant effect on our pain.
Let's take a moment to review the chronic pain cycle that we discussed in Module 1. We learnt that pain can cause a fear of movement as you don't want to injure yourself again. This may lead to general reduction in movement, general deconditioning and weakness, both at the site of the injury and also throughout the rest of your body. Due to the uncertainty of pain, our thought processes, memories of past pain experiences, and emotional reactions to pain, stress, anxiety, and depression can develop. These processes can lead to physical and functional decline and worsening pain. You can understand how your pain has implications beyond just the initial injury. In Module 4, you will learn how to manage pain effectively by trying to fix not just the initial injury, but by using strategies to work on improving all of these other effects that your pain condition may cause. Let's quickly recap on how chronic pain can affect you. As we are discovering, pain has effects wider than just the area of the initial injury. Chronic pain causes an increase in sensitivity of the nervous system. This sensitivity increases the amount of danger signals sent through the nervous system to the brain. This can result in what we term fear of movement, as you may reduce your movement in an effort to avoid pain and injury. You may become overprotective, reduce your activity further, and this can result in deconditioning. Due to these problems, mental stress and depression may arise. This could include worry about not getting housework completed or fear that the pain may never go away. We discussed how this may affect someone while they are driving or working at a computer. What about a more active example? After all, sports people have injuries, often bad ones, and they have to get back to high levels of fitness and activity. Think about football players coming back after knee reconstructions. They have similar problems that you are going through. They have had a long time off their sport and have become weaker. They become anxious and doubt if they will ever get back to the level of fitness and strength that they need. They remember that the last time they got tackled, that they hurt themselves badly. So what do sports people do? As soon as possible, they start a small level of activity. They might begin swimming or doing some exercise for other parts of their body that they did not injure. Gradually, they will increase this and add in gentle exercise for the injured part of their body. They will gradually upgrade their strength around the initial injury and also their level of general fitness. They will talk with a sports psychologist about their rehabilitation, their anxieties and their doubts, and the psychologist will provide positive and active strategies to help achieve their rehabilitation goals. They will gradually resume training with the team and eventually get back onto the field. When we discuss how to manage your pain condition in Module 4, you will see that what you need to do is not too different from what a top-level football player needs to do.